Hello everybody, and welcome to the Thursday edition of Video Clips. Just before I start on today's health information, I hope you've all visited my website at drpampopper.com and watched the videos there. And I know some of you felt inspired to take your health to the next level and take advantage of some of the programs that we offer on that website. And of course, you're always welcome to email me with questions at pampopper@msn.com. Okay, so I want to talk about kind of an inspirational thing. I'm excited about this message, this part of the message, because it's about parents getting healthy and helping their kids to do it too. Parents are in the best position to make sure that eating a health-promoting diet and exercise are part of how kids grow up and part of their of the way they live their lives as adults. And so I was really intrigued when I found out about this Healthy Dads, Healthy Kids program in Australia, which was designed to help fathers to improve their health and lose weight and to model good behavior for their children. The program was taught in a community health setting by physical education teachers who had received some extra training. The participants were all overweight or obese fathers who had children, and the families were randomized either to an intervention or a control group, and the families that were placed in the control group were told that they were on a waiting list to get into the program. The dads in the intervention group attended 7 weekly 90-minute sessions that were taught by those physical education teachers. The program taught fathers about the importance of healthy eating and physical activity, and it also showed these dads what a great idea it would be to use healthy eating and physical activity as a means for spending more quality time with their children. So the dads went to the first 4 sessions by themselves, and then the last 3 sessions they brought their children with them. So at the end of the 14-week study period, there were no sessions weeks 8 through 14. So 7 weekly sessions, then 7 weeks on their own, and then an evaluation at the end of 14 weeks. So the fathers in the intervention group had lost 3.4 kilograms, 2.2 pounds per kilogram. That gives you an idea. Then the fathers in the control group. The dads in the intervention group also had better drops in waist circumference and resting heart rate than the dads in the control group. The intervention dads did better on calorie intake and activity levels, and the kids whose dads were in the intervention group had a higher drop in BMI and took an average of 1,625 more steps per day than the kids whose fathers were in the control group. So here's the bottom line. Anybody who's spent time around children knows that they imitate everything that we do. And they're far more interested in what we do than what we say. And sometimes demonstrating good behavior goes a whole lot further than lectures about why you need to eat healthy or encouraging kids to exercise on their own or join a sports team. And I also think that part of the dynamic of this situation here that could be very valuable is that when you approach healthy eating and exercise as a family project, it can keep the parents on track as well. Most parents really want their kids to be lean and active and healthy, but many of them think that they don't have time to spend on that type of activity themselves. They feel like it's a selfish type of thing. So if you frame engaging in health-promoting activities as something that will benefit children, it may make parents more willing to engage in these activities and eliminate some of that guilt that goes along with thinking, oh, I'm just doing this for me and I'm taking time away from my family and all that sort of thing. So the earlier you start this, the better. And even if you have teenage kids, it's not too late to start because they do watch what we do and they do tend to imitate and take their lead from what they see their parents doing. So anyway, all you dads and moms out there, get out and work out with your kids and eat healthy food with your kids and make this a family affair. All right, so this next message is an interesting thing. I've always said this, but now there's not just this study, but this study and many others have proven what I've said, which is that what you think about your health status and your health outcomes matters a whole lot. I've seen it in terms of differences in health outcomes, even for really seriously ill people who think they're going to live, and they do, versus people who think they won't, and that can impact the outcome. And so what does that have to do with public health and what's going on today? Well, we do a lot of screening programs right now, and a lot of them are ineffective. You guys have heard me talk about that for years. They harm people. Risks include things like false positive, diagnosis of clinically insignificant stuff, false sense of security that health is about screening and it's not, and over-treatment. And so screening programs often result in healthy people being labeled as sick patients, and This study and others show that that labeling makes a difference. In other words, if a person perceives himself or herself as being sick, more likely to have complicated health issues, and also more likely to die. That's kind of scary when you think about it. The authors of the study state that people who don't know they have a health issue rate their health as good, while people who have been diagnosed with anything, even something mild, experience a worsening of their self-image. And it is that change in self-image that begins to change health outcomes. It really is a self-fulfilling prophecy. If I think, oh my gosh, something's wrong with me, I'm going to die, well, that tends to be the way things go. The authors state that while early detection can benefit some, disease labeling hurts others. And I'm going to paraphrase this because it's kind of a long paragraph. I've included it in the article for you to read online in its entirety. But basically, the author says we have ever more people being labeled because of screening and lower diagnostic thresholds and commercial and non-commercial health campaigns and so on. We have more people being rated or diagnosed with illness. And self-rated health is shown to be inversely associated with mortality. In other words, what you think about your health matters, is what he's saying. And he also talks about in the article the fact that when people are diagnosed with conditions that are clinically insignificant and given all kinds of treatment that doesn't change their outcome, we mess up their head and we don't change the outcome. That's basically what he says about this whole thing. And he's referring to practices like taking somebody who has slightly high blood sugar and calling them pre-diabetic and maybe even putting them on drugs, taking a high normal hypertensive and saying you have high blood pressure and you need to take medication, or women who have been diagnosed with ductal carcinoma in situ being told that they have cancer when 98% of the time it isn't going to turn into cancer at all. So how the researchers did this, it was done in Norway. 33,734 adults between the ages of 40 and 70 who were screened in the mid-1990s. The researchers asked the participants, how is your health at the moment? And also if they knew if they had any diseases such as diabetes or hypothyroidism. Those who'd been diagnosed with something, anything, were less likely to say they were in good health than those who'd not been told they had a health condition. In fact, some who had undiagnosed conditions, they didn't know about it at the time the question was asked, they actually rated their health as better than people who had known serious illness. So again, what you're thinking about things matters a whole lot. The researchers concluded that people who don't know about their conditions may worry less and be more optimistic, and also more inclined to visit doctors just for checkups or if they have symptoms. Jorgensen cautioned that people should ask if a proposed health screening will benefit them or increase their lifespan before agreeing to it. Gosh, does that sound familiar? I've been saying this for years. In a stunning admission, he said, quote, "The main effects of checkups are more people being defined as sick, more people undergoing treatment without lowered mortality." In other words, we're real busy doing stuff in the medical profession. We just aren't making much of a difference in how it all comes out in the end for patients. Now, one of the more stunning admissions, in my opinion, is Dr. Otis Brawley, who's the Chief Medical Officer for the American Cancer Society, agrees with this, and he says, we've got data to show that depression and suicide increases in men who are known to have an elevated PSA, high PSA. Not men who have prostate cancer, but men who just have a high PSA and are subject to additional evaluation. And so he agrees that we know that any negative information about health is likely to change your attitude about your own health status, and it can affect you in adverse ways. So I want to be clear. Nobody's suggesting that symptoms should be ignored. Symptoms are a clue that something's wrong and you want to find out what the problem is. And no one is suggesting that sick people not be treated. What is being suggested here in this study, and what I've been saying for a long time, is that we've got to stop pulling people out of the living rooms and shopping malls of America who think that they're fine and have no symptoms and test them until we find something wrong with them, and then treat the heck out of them until we turn them into sick patients. And that's the stuff we've got to stop. So we just overdiagnose too many people, and I'm going to keep talking about it until more people learn to do what I keep talking about in my public talks. Just say no. You just got to say no to this stuff. All right. That's all for today, and this week actually. Have a wonderful day, rest of the week, and the rest of your weekend also, and I'll be back to you again on Tuesday with more news.